So talking about fillers, so this is something where I would say mid-face fillers are something where you really want to go to an experienced injector, someone who understands anatomy. Some of these things are off-label actually that we do here at the Calm, very common procedures that we do. But when we're doing fillers, which fillers are to add volume, it's really important that you're not treating lines. And I find that when I'm training other injectors, that's a big mistake that I see. They see a line and like, cool, fill that line. Yes. You do not fill lines. You fill the why you have that line. So why do you have this line here? Well, it's probably not because over time you're just getting a divot in your face. It's because you're losing bone, you're losing fat pads, you've got ligaments that are loosening, those kind of things over time. And so what Tori and I both do when we assess you for a filler consult is to say, why does she have the lines that bother her? And then we address the why, which then gives you a very natural correction because we've corrected where the aging has happened as opposed to corrected the line.
And I think that's a great point Dr. Holman makes, the difference between Botox or neurotoxin and filler. You know, neurotoxin is what corrects lines over time. Filler is filling in where you've lost volume. And like she says, the mid-face is someplace that really does lose volume and it has an effect lower because gravity always wins. And so when people start talking about jowling and all that kind of stuff, look higher up. And that's where we're always looking with you. We're looking at your tear troughs. We're looking at your cheeks, your temples. And so today you're going to see us do a mid-face correction. The patient that we're treating is not old. She's young, but she is doing preventative maintenance. And so she notices that she does have tear troughs. She notices that she's already starting to see some volume loss in her cheeks. So by doing little subtle corrections, we don't have to put 5 syringes of filler in your face. We can start with 2. And patients often ask, what's in a syringe? So syringe volume is just 1/5 of a teaspoon. So imagine how little that volume is. We won't hurt you. We can't distort you with just a syringe of filler. And I think that's one of the common barriers to getting dermal filler is they're worried that, am I gonna get duck lips? Are my cheeks gonna look puffy? Well, we can't do that with 1 syringe of filler. So a good way to come in is let us look at your face and let us do a consultation. Today, we're just doing cheeks and tear troughs on this patient, so you'll get to see the full procedure, which is really non-invasive. It's really not very much trauma. I'm gonna let Dr. Holman talk through some of the anatomy that we're very cognizant of because again, seeing a professional, a medical professional that's really aware of anatomy is super important. The way people get hurt is when people are not aware of and not slightly frightened of anatomy.
Right, and the other thing to know too, when you come in for filler, it's really important that filler is not one size fits all. If you open my filler cabinet, you're gonna see like 15, 16 different boxes of different filler. And that's because it's really important, not just how we're doing this filler, but what product we're reaching for and choosing with every different anatomic area and every different patient that we treat as well. And again, with all of our fillers, we've got rewards programs also. So in addition to banking your buck and saving that 20% ahead of time, we're gonna check these rewards programs every time as well to see what does Galderma Allergan have to offer you every time you come see us to save money on your fillers because we're conscious of your dollars as well. And so when you're looking at a mid-face, it's always really interesting to me when someone comes in and like, I hate this flat part of my face right through here, I hate these lines right through here, and it has nothing to do with those areas. It actually has to do with your cheeks. And if you start looking especially at celebrities and those kind of things, they have this beautiful kind of rhombus look through there with these really nice lifted cheeks. And it's that triangle of youth because as we age, that triangle flips the other direction. And so by lifting in that cheek area, we're really restoring that volume to the mid-face, but lifting that lower face area as well. And so there's an anatomic compartment that's deep right through here that's really a nice area to fill. And so you emphasize the zygomatic bone, you fill that deep anatomic area, lift, bring a curve to that lateral cheek through there, because with cheeks especially, the problem when people say, I hate this line or I hate this, you're looking at yourself straight on in a mirror. When we come in and look at you, and to be honest, when the rest of the world looks at you too, we're looking at you 3-dimensionally. And that's where that correction happens to look the most natural, is when you're lifting that lateral cheek area through there as well. Tear trough correction is something that we do pretty conservatively, but a lot of times, you know, as we age and we lose, there's a fat pad that's right down through here that as you lose that fat pad, you start to see kind of some shadows under your eyes and you just look tired. And sometimes it's genetic as well. I mean, some people genetically have that, you know, that flatness or that darkening through there. And so we typically just split one syringe of filler if we're correcting that area. You want to be really conservative, because if you overfill that area, it looks like you've got allergies or you know, puffy eyes, those type things. And so we're always very conservative when we're filling in that area. But I'll be honest, it's one of those things. It's a small correction, just a half syringe of filler on each side here that we're going to be, you know, showing you on Maddie today. It's a very small correction with a huge payoff. The other thing you're going to notice as we're treating this patient is that we're using something called a cannula. So there was a guy in New York who started doing filler on his patients, and the biggest limitation, especially even when I started doing filler a decade ago, was that I'd send people home and it looked like I smacked them in the face with a bag of marbles, because they're all beat up and bruised up, and just, it was like, okay, I'm going to get my filler, but I'm going to have to block 2 weeks on my schedule. So with cannulas, and I'll let Tori talk about what that is, we've changed the game on bruising and trauma.
I really get excited talking about cannulas. If you've ever looked at our Instagram, I'm always like, and Dr. Holman and I use a cannula, because it is so different than using just a needle. So a cannula is a long, blunt tipped object, meaning it's not sharp. It's not severing vessels and severing anatomy under there. It's literally just kind of gliding past everything you need to keep intact and things that are important. So that way there's so much less bruising, there's less trauma. And so patients are always really concerned, you know, like, how long is the downtime for filler? Really no downtime. You're ready to go when you leave. You know, we numb you, we always will numb you for filler, 10 or 15 minutes of topical numbing. And then by using the cannula, you leave and it's pretty painless. I mean, there are parts that are uncomfortable, but you leave and you're just ready to go. So I think a cannula is truly what has changed in our practice, that's made a huge difference for patients and made them say, you know what, I can go get cheeks and tear troughs and temples filled with really minimal downtime and bruising.
Yeah, and so you see for the bulk of the injection sites on this patient, it was just 2 entry ports, and I'm able to do a lot of work and fill a lot of area because that cannula allows me to do that. But just traumatizing her skin in 2 spots on each side, we can work on that whole mid-face area. So again, this is an area to treat that just come and let us assess you.